Well, greetings again. This is Dr. Bill Wyatt with the American Orthodontic Society, and I want to talk to you this morning a little bit about something I came up with several years ago, and over the period of time, I had problems with some people wearing these Class 2 elastics in correcting a malocclusion, like bad Class 2. And some people would wear them, and some people would wear them a little bit, and some people just wouldn't wear them at all. And I had a nice little kid that I was trying to get this across, and I worked for several months trying to get this Class 2 corrected, and the guy just would not wear the elastics. So I came up with an idea of how to force, or nearly force, I want to put that word nearly force, them to wear it. I had one kid that wouldn't wear them anyway, and it pushed his front teeth out like mad up there. So I'll have to show you how to do this in this video. Let's get started here now. I'm going to get my dot going. This is a nice kid and no big problem that he cooperated and did things, but he just flat would not wear the Class 2 elastics. Now, it didn't seem to matter. He's up in a pretty bad Class 2 problem here with an overjet, an overbite, quite a case. It looks like it's about several millimeters out like that. You can look at the molar teeth back in the back, and you can see actually your lower molar ought to be out in front of your upper molar, and instead of like that. This is the deciduous molar that's in the correct place. And that's the distance between here and here. And of course, something in there, but kept his bite open too at the same time. And so it's obvious it needs to correct that problem of Class 2. So here is what we came up with to correct that. Now, once we got that corrected, we could just, we got the bite closed too. Now, here's what we put on the child. It's hard to get a picture of it completely, but we put a sliding spring in this part, and I had a little nut here, and I would tighten this down to a certain amount. Say we were using about 2 ounces of force to force these teeth forward if he didn't have the elastics in there. Now, if he wore the rubber band, I would give this about at least 2 more ounces of force than this spring had right here. So while he was wearing the elastic, you'd pull that out and hook this up. He would feel only a couple of ounces of force on his teeth. And that small amount of force forced those teeth to go if he was putting the elastic on. But he'd take the elastic off, and by the time he'd eat lunch or take it off, these teeth would be hurting because this force would all be going on the teeth and pushing the teeth forward like that. And I had another young man that I was working on, and he was in an orphanage, and he wouldn't wear them either. And I worked on him for about a year, and I could not get it. I was just going to take them off. And a person that I had corrected their teeth in that orphanage said, if you'll just stay with it a little more, I'll make him wear these. And so I put this device in there for him, and you put a certain amount of force on this coming out of your slot in your tube back here, and this is on both sides. See, you put a couple of ounces of force, and now you've got 4 ounces pushing forward like that. And now you have to come in here with a little more force that's pulling back, so you take all of that away and you add the other 2 ounces to it like that. And then you add that, and you could get these class 2 cases fixed in just a matter of about a third of the time that it normally would be to do that. Now here we run this also, we'll close the bite down. If you go back here and look at the way his teeth met, up here he's got a kind of an open bite problem. So we corrected that when we pull this down and back as we corrected it, and brought this out and brought these teeth up some here. Now we'll get back over here and let me show you what turned out. Now you line up your upper 4 teeth. In other words, there's laterals, centrals, and laterals right here. Have a rectangular arch in here that's pushing on. So it's bringing the tooth out almost straight. It may tilt a little bit leaning out here, but it's got that torque on it to keep the teeth going forward. And so you put this on, and now you come in here with a hook and you put the rubber band. Now while he's wearing the rubber band, he'll only feel about 2 ounces of force on him, which holds the teeth there. Yet the force is up there, and now you hook that up like that, and I had this other boy that wouldn't, he was older and he wouldn't wear them, and we got him to agree to it, and his fellow watched him and he took care of him, and he said in just a couple of months or so we had the thing corrected. So the constant wear of a force has a lot more effect on it than in and out or just a part-time and wearing it just once in a while like that. And so we developed this out, and you could hook this up, put this arch right here, goes in a sliding slot on his, and you got a spring in here, and you put whatever force is on the spring, lock that nut down right there, and do the same on the other side. And you usually gave maybe a couple ounces on each side, and that'd be about 4 ounces pushing on this constantly. And you wore this with about 6 ounces, and that would give you just 2 ounces to correct the class 2 problem here. And if you put that on there, that has got that constant wear. This guy said, well, I'll take the rubber band out to eat dinner or something, and my teeth would be hurting up here. So I had to hook the last rubber bands back. So that's why I say it nearly forced it. I had one kid that just wouldn't wear it anyway, and it pushed his teeth way out here. I had to get him back real quick, and I don't know exactly how we ended up straightening his teeth, but we got his parents watching him like a hawk to make sure he wore that, and it corrected it. Let's go on now. We'll see if we get a little better picture. That's not too hot of a picture right there of it. And here the deal goes back in here, and we have the spring pressure on it coming up here, and he wears the elastic. And this wire here is connected only to the 4 anterior teeth. And if he doesn't wear them, these 4 teeth will be taking the load of this spring woman off of the molar back at the back. And that causes the discomfort with these teeth in just say 30 minutes or an hour or something like that, and you can begin to really feel it up here. And so they bring it back, and this works. So you people might look at that and say, can I do that? And on the bottom we did that slicing technique here, lined these teeth up, and we broke the tongue thrust habit at the same way that we normally do. And by the way, this is the best way to break the tongue thrust I've ever found. But you want to make sure you've got the airway open, because kids can't breathe through their nose. This is very difficult for them to start breathing through their nose, and so they need to go into an ENT guy and have him check that out. You got to correct the breathing problem if you correct the tongue thrust. So this is a tongue thrust case, and it was by the slicing technique, lined all that up, and now we'll wait till the cuspid and the first and the second bicuspid come in. So this is the deciduous teeth here, and that's the permanent 6-year molars behind them. So this is what it looks like. You don't even see it when you look in, but that gives you control over opening and closing the bite and bringing it back at the same time. And you may do that, and I'll almost guarantee you, if you have an adult that's not wearing this, you could put that on there. It would make them, they would know that they had to get that rubber band back on the side back here to keep this from hurting in the front. So that's a way we said it, nearly forcing somebody to wear them. And that really worked out. And so I thought I'd pass that idea on. It makes it more effective. Now that looks complicated, but it's not really. You have a molar tube with a sliding opening in it, coming right off the 6-year molar, and it pushes back on that molar at the same time as the elastics. Now when you got the elastics in there, it overpowers this, and that extra force corrects the class 2 elastic. And if you are having trouble, try that out. And that's in the mixed dentition. See, we didn't have any, this wasn't hooked into it at all, and these teeth aren't even in it and everything right there. So that's when you've got the mixed dentition in. But this works in a totally adult case. If somebody doesn't wear the rubber band, you do this, and I'll guarantee you, if they don't do it, their front teeth are going to move out. So you better see them back pretty quick to make sure that they wear this or else. So here we go. This had the tongue thrust. We work on it at the same time. So this is the way adult cases, and this is pediatric orthodontics, and this is what pediatric dentists ought to know how to do this, and ought to be able to do it any time. It's a little more advanced than this putting the wire off of the 6-year molars like most of the class 2 people are talking about. That doesn't have any force to make them wear it. And this would do that, and we're handling the tongue thrust thing at the same time. And let's see if we have any pictures of the thing after we treated the young man. And that was mixing in a reduction of these teeth. And by the way, it is far better to reduce this tooth rather than extracting this tooth. If you extract it, the permanent cuspid under there just falls into that space, and then you lose arch length. So reducing or doing this pulpotomy is something that's far better than taking the teeth out like that. That just gives them just enough room. The cuspid comes in in a normal position when you do this. That's adding up to several other things you work with on this. Now here we got the teeth back now just about where we want them, and we continue with this until we're just about where the person finishes up. And this is poor picture was taken quite a few years back. And let's see, you could use a lip bumper on something like this. You might, if you don't have the soft tissue for the teeth moving out like that. But that works. And we got a lot of pictures here, but I will just run through them. And we got that back in place. And so here's where we started. There's where we ended up with that, like that. This is poor Panorex. Let's just skip over that. We've got it corrected now. Now look, when we trimmed these two teeth, we left this root here. If you extract the tooth, this tooth will move into this space completely. Now it's got to resorb and work on it as it goes up in there. So you lose arch length doing this if you extract the tooth. But if you do the reduction, pack that zinc oxide and eugenol in that tooth, and I know thousands of these pulpotomies on healthy deciduous teeth, and I have yet to have one of them that went bad on the way. And if you need to take a little more off to get this tooth in here, now this tooth took up this side right here, so this is about 3 or 4 things in this particular case right here. And I hope you realize that and learn how to do the pulpotomies and placing the teeth there. And that still saves enough room. You can squeeze these teeth into this area. Your cuspid will take about this much. The first bite, something like that, and the second bite can come in right up underneath there. And now this is the 12-year molar coming down from up above, and it'll move in, and there'll be wisdom teeth too. So let's get on down the way. Now there this device goes back. See, it just comes in a slot back here and pushes back on this. And so if they leave this rubber band off, this spring pressure in here and here will shove these teeth and make them very uncomfortable, and they come in and put the elastics on after. And this young man, it was older, we did this, and he told me after we got through, he said, man, I couldn't finish my dinner until I could get back in here and put those elastics on. That kept it from bothering me. So this is something to pass on. If you can get people to wear the elastics, you come out with a better, nicer looking set of teeth. So I thank you for watching, and this is something that you can do in here to encourage. This was a nice kid every way, and we finished his teeth up like that. So thank you for watching, and I'm going to sign off, and hope you'll join our deal and sign up for our program. Thank you now, and I'm going to stop.